I'm Fikile Mbalula. It's Sunday and it's time for The Fix. Welcome to this edition of The Fix, where every Sunday we hold the decision makers to account. We tell you why it matters, how it affects you, and why you should care. You're watching The Fix with me, Fikile Mbalula. Now, travel restrictions and cancellations of mass events are expected as South Africa moves to contain the spread of COVID-19. South Africa's transport system is still rooted in apartheid spatial planning, with black and poor communities braving the odds on trains, buses and taxis that are unreliable, late and unsafe. Moreover, the corruption at PRASA has compounded matters, with many worrying if the situation is beyond repair. To talk about this, I am joined in the studio by Transport Minister Fikile Mbalula. Minister, thank you so much for your time. I know that you have made special arrangements to be with us this morning on The Fix because you're heading to Pretoria for a cabinet meeting. We've now got 38 confirmed cases of the COVID-19 virus. There are, of course, massive concerns from the public. When we look at our testing facilities, we've got over 70 land port facilities that registers and monitors when people come through our borders over and above the airports. Can you tell our viewers if there are testing sites at all these ports?
There are testing sites, not in all ports, which have got to be intensified with a package of drastic measures that need to be taken that affect us as transport in terms of commuters and so on. Trains, we have to up our game and ensure that we descend on the places where people congregate en masse.
Now, when one looks at those ports, the biggest ones that we have coming through is obviously your bike bridges and so on. Do you have a number of the ports where testing facilities are in place? The MEC for Health in Mpumalanga, for example, was saying that she's got people out at ports. Just give us a ballpark figure. Which ports in the country, landlocked ports, do have testing facilities, and where do you have to jack up and put testing facilities in as soon as today?
I will tell you, Karima, I can't give you a ballpark now because we've got to do that assessment and intensify. It has to be in all ports. And if I can tell you that is only in Mpumalanga, I know for a fact airport, AXA has actually ensured that in all the entry points, the testing happens there. And that means Bait Bridge and all of that, we've got to get all our entities as of now going forward to ensure that they are on board. The CRPTA cross-border, we've got to get AXA, we've got to get ATNS, all of those entities to come on board in the defined drastic measure strategy implementation.
Now, in terms of our ports, when I had the head of Transnet here, Portia Derby, she was saying that Transnet is fine, and because of the gestation period, especially with vessels coming from places like China, that they were okay. Given the fact that the World Health Organization has now declared this virus a pandemic, which means it's across the globe, and we've got rapid numbers and shutting down of borders in the whole of Europe, so to speak. How soon are you going to get there? I know the Cabinet is only sitting this afternoon, but surely you've been monitoring the situation since the outbreak.
Yesterday I got a report from our entity, South African Maritime entity, and there are cases of coronavirus that have been detected, not of our own people, but people who came elsewhere and via South Africa, and the dogging in South Africa and so on. So we have to be all over and respond at all entry points. So we will be expected to provide that detailed plan to the IMC and cabinet today.
Now, when the maritime authorities were in contact with you, they actually managed to pick up people that are infected with the virus, even though they're not South Africans. Where are those people, Minister? Are they in South Africa? Are they on South African vessels? And what safety measures have been put in place to secure those people and the safety and the health of everyone else that comes into contact with them?
There are WHO standards that have been pronounced that all countries and entities will have to abide by. Obviously, we've got to undertake a mission of quarantining them and all of that. But it's not my call to make those announcements. I was just making an example. Obviously, today, we will look into those issues and present our total plan in the context of drastic measures that need to be taken. Obviously, the mood dictates for that.
Now, let's look at public transport. South Africa's public transport is very patchy. We've got packed trains, we've got overcrowded trains, we've got overcrowded buses, overcrowded taxis. If one wants to stop this virus from spreading, people have to stay away from each other, both physically and otherwise. How is that going to impact on your ability to deal with this virus? Are you planning, mass disinfection campaigns at stations like we've seen in countries like Korea, South Korea, Indonesia and other places? What exactly are you planning for the trains, for the buses, where overcrowding is a big issue?
There's got to be random testing in those in those areas, and then we'll have to do random testing in the trains, in the buses, in the taxis. That is what we've got to do, and we've got to think through of other strategies that we can implement. Of course, learning from other countries globally, which all of us were actually affected, and how do we deal with the mass people who are affected by means of mass transport. Now, so that has got to come in a week's time and even from now onwards.
Okay, where is the personnel going to come from? For example, when you say the Transport Ministry, what staff do you have to do that testing? Is that located within Transport? Is that going to be combined with other ministries? Where's the people going to come from that's going to be doing these testings?
If you take, for instance, cross-border, we've got personnel which can undertake that mission working with other agencies. It's a multidisciplinary approach, like you can see at the airports. Which agencies,
for example?
At the cross-border, you've got the police, and then you've got cross-border officials, you've got SARS, so they will undertake that particular mission there. And then at the taxi level, obviously, you've got to work with taxi industry with regard to the personnel that they've got already to be trained on this, and at the same time to be equipped to deal with the detection that needs to be undertaken.
Now, when we ran the PILA campaigns around HIV, people obviously engaged Santaco and other taxi organizations, and a lot of field workers were put in place. Are you going to be reactivating that kind of infrastructure, and is it ready to go, or do you still have to meet with the churches? Do you still have to meet with, community-based organizations? What is the state of readiness to, let's say, deploy hundreds, if not thousands, of people into trains? We've got Controlesa already calling on the government to make sure that messages, for example, are going out in all languages, that they are spread across all countries, because obviously our inequality situation makes the poor a lot more vulnerable than everybody else.
Karima, every detail should be defined, and that will include who carries the message, but we are working all together, including media and so on. We need to intensify education, but we need to also intensify prevention. Test, ensure those that are tested are taken elsewhere in the areas where people congregate. Where we can, we've got to take drastic measures that include prohibiting such happening. And in our space, because people will have to commute, go to work, they've got to have masks. And then how do they get those masks? Where will they actually come from? And we've got to produce more, because we've run out of that, and we're not ready for this. So all of those things have got to be activated,
Minister, when you
in a detailed plan of action going forward.
When you say we are not ready for it, what exactly do you mean?
I'm saying that we were not ready because this is a disruptor. It's not that we are not ready. We've got to be ready and put our plans into action. That's what needs to happen. When we say we are not ready, it meant that when this happened, we did not plan to have millions of masks because there is corona that is coming. Now that it is here, we've got to get that going so that even the mass people who use means of mass public transport can have access to that. So that's what I'm talking about.
Okay, Minister, obviously the situation on the trains as it pertains now is not going to help you because we've got trains that are unreliable, we've got trains that are overcrowded, that are full. You've recently unveiled your plans, particularly in the Western Cape, where thousands of commuters were left stranded, for example, because you hadn't paid your electricity bills. Just take us quickly to the Western Cape. What is the plans there for PRASA trains, and will those trains be running on time?
First, the central line in Cape Town, which carries 20,000 people to and back from work, working class on a daily basis, has been shut down, not now, since last year and even before I came in. So what we have done, we're implementing a program of refurbishment, take out people who have encroached in the airline. Encroachment is an unfortunate word because people have, built shacks on top of the railway lines in Cape Town, in the central corridor.
So where is the railway police or any other security protecting the assets of PRASA from criminality, from people that encroach? I mean, why is that situation even as it is?
Karima, that is depleted. Let's leave that for now.
So there's no
There
police.
is, but it's minimal. It's minimal. And our plan entails a holistic security plan going forward. When we talk about it now, I can say, yes, we have railway police, we have that. Look, let's talk like it doesn't exist. The network is not protected. That's why trains get banned. That's why all those things are happening. That's why we've got to implement this refurbishment that entails a security plan. Not only in Cape Town, in all the corridors where we've got rail network, passenger rail and so on. That is in our plan. Security, refurbishment, ensuring that there is less congestion and the people are not robbed and trains run on time, all of that. That's what we're implementing right away.
Okay, Minister, we have to take a short break. When we come back, we will continue our conversation with the Transport Minister, particularly looking at the corruption that makes it all the more difficult for people to access public transport. Don't go anywhere.